Hello and welcome to week 3 in your capstone course. Today I want to cover a little bit of information both about the project and also about an upcoming project for Sentinel City. So first we're going to talk a little bit about the project in regards to the objectives for both the project and the interview, as well as identifying the interview questions and your key person for your interview. When we think about writing the objectives, both for the project and for the interview, we want to ensure that we're using the SMART format. So they need to be specific, it needs to be measurable, achievable, relevant, and have some kind of time parameter. For the time parameter for this particular components, it is acceptable to say by the end of this project, or by the end of the interview, because that does say at what point these objectives will be met or addressed. So that can be your time frame. And the other components we're going to talk about as we look through some examples in the next couple of slides. So a couple of semesters ago, one of the students looked at grief support for nurses within the hospital setting. And so these were the actual objectives that they had submitted for their project. So I thought to make it kind of easy to understand and let's see how these would look. These are what they had utilized. And again, this is just specific to one project, but it gives you an idea of the format. So if we look at the first one, by the end of this project, we will evaluate how grief support for nurses affects nursing care and patient outcomes. So some of that is achieved by your literature review. Again, what's the broad purpose of that? So evaluating the information. The second objective focused on analyzing the different modalities of grief support and also included some of the feasibility of the implementation. That could potentially be really covered in 2 different objectives. This was a rough draft, so you could break that down and have, by the end of this project, we will have analyzed different modalities of grief support, and then a second objective that says by the end of this project, we will have analyzed the feasibility of implementation of a grief support program into practice. The last one that the students had utilized is to look at the change barriers to implementation. And so with that objective, it was really recognizing that part of the process we're going to go through is to include a change theory and see how that change theory is going to impact how we plan our project. So overall, looking at the project, you're evaluating a potential change, you're analyzing the different methods of implementation, the feasibility of implementation, and potentially even the change barriers related to that. So it's really broad objectives that you're doing for the overall project. The interview objectives, on the other hand, as you can see, there's several more of those than there were for the project objectives. There's no set number. It really is looking at what needs to be achieved, and that varies a little bit depending on the specific topic. So within these interview objectives and then the questions that delve from those, I have a couple suggestions in ways that these students could have tweaked or changed their interview objectives. So we're going to talk through that. So you see at the first one, by the end of the interview, we will have explored the current state of practice and the policy utilized. I suggested that they end that objective following that word utilized, and that those other details that they wanted to gather out of that to meet that objective really are questions that you're asking towards addressing that objective. So your questions are going to be the details that you want to meet your objectives within the interview. So that was one suggestion. So make sure that these become a little bit more focused, but not to the point of specific details as the questions will be. The next one, we will examine the facility's method and time frame for implementation, including again, you could end this and then in the questions talk about how they introduced it, what education they provided to staff. So that could be, again, the questions that could delve into more of that detail. If you continue to go on, they wanted to ensure that they identified the barriers that were found from the interview With implementation, they wanted to identify which patient care areas the interviewee had implemented a similar program, how effective did it find, and how did they measure outcomes, both for patients, the program, and the overall process of implementation. And then just analyzing the overall impact. So the things that we think about with many of these staff support kind of programs is, does it impact overall workplace satisfaction? And in here you could end that objective after satisfaction in this last objective and think about the remaining details as questions. How are we measuring workplace satisfaction? And we measure it in retention, peer relationships, and relationship statuses between nurses and management. So those lend themselves well to some different outcome measure tools that we could utilize. Now, as I've kind of said, as we went through these different objectives, you could easily see how they then develop into maybe 2 or 3 questions or so out of each objective. And so you'll have a pretty good list of questions that you have formed in order to see how this practice has been implemented in another setting. So the goal behind this interview isn't to interview somebody within the setting you're hoping to implement, but rather to implement somebody from a different setting who's already done this, and how did it go for them? Because that will help to guide your plan for implementation of a change within your own setting, and maybe to identify some of the barriers that you haven't considered and that didn't necessarily come up within that literature review. So once you have developed some of those questions and things, the other thing that you'll be submitting via the discussion board this week will be the interview contact person. So there's a variety of ways of locating an appropriate person. This can include looking through your articles to locate somebody who's implemented this change already in another setting, and it could be anywhere. Across the country or possibly another country. I have had that occur with students depending on the topic. It could be somebody local. Maybe you know that another facility here locally has implemented this project or a similar project, and you can talk to them to gather some information about how that process went. You do have to get approval before moving forward with the interview so that you are well prepared, that your questions are identified, and that you're ready to go before you move forward with conducting that interview. One thing to consider as you move forward with this is, how are you going to start the contact? So likely that will be by email. And in that email, you're going to want to discuss who you are, why you're contacting them, what the purpose of the interview would be, about how long you think it would take, and usually that's around 30 minutes. And get their approval to schedule a time. Ideally, when we do this interview, you're doing it in a way that you're able to obtain the nonverbal cues from the person that you're interviewing. So face-to-face is obviously the first choice. You could always do Skype or FaceTime or another video conferencing method, with phone interview being the last choice because you lose those nonverbals completely during that method. Once you have gotten approval, you've contacted, you've got that time scheduled, when you start the interview, again, you're going to kind of summarize and then give a broad statement. Like, tell me about your process of implementation for this topic. Likely, as they start chatting about their process, you're going to have all of your interview questions answered, or a good number of them, without having to ask a lot of questions. These people, these key informants who've already gone through these changes and implementation processes, are passionate about the topic, and so they're going to likely give you a lot of information without you asking every single question on your list. So kind of keeping track, taking good notes as you go. The other thing that I want you to keep in mind, again, is that you need approval. So I want to know who you're looking to interview, when you're planning to schedule it, and how that interview is going to be conducted. The other thing to think about, if you start this discussion board post and you're really struggling with identifying that key contact person, please note that in that discussion board, and we can work together to identify a good informant for your project. As you look through the discussion board posts, you're going to be giving some feedback to your peers on formatting their objectives and their questions to ensure that they're getting. You may even have somebody in mind that they could contact if they're struggling with identifying a key informant. So again, there's lots of help that we can give each other through that discussion board format in finalizing these details. The next thing we want to talk about is a project that's coming up in Sentinel City. So during your population health course, you talked some about emergency planning. And so during this activity in Sentinel City, you're going to look at some things that need evaluated, as well as some appropriate considerations for emergency response planning in various practice settings, because there's different plans at the daycare setting versus the hospital and how they're going to manage that emergency response across those settings. As you begin this assignment, the first thing that you need to think about is that you're going to enter Sentinel City and you're going to locate the area by the ABC Daycare Center. Once you've kind of located that area, you want to observe what services are available, routes, and populations that may be involved with the city in that area as a result of a hostile situation. When you click on the information icon for this daycare center, there's some information about the daycare center, and there is a video regarding the hostile situation that's taking place. So you want to watch that video and take note of what's going on. What's this emergency that's happening? So once you have done that, you want to think about what are the potential public health effects, environmental hazards because of that. Who are the various members and the roles of the emergency management team that would be activated? And it's not just a single entity or a single type of person. What are the various social media responses and news reports that have happened on this incident? What are the risks and benefits of those social media responses? And then I want you to focus on a specific healthcare practice setting. And you can think of any of those that are listed, and identify 3 evidence-based considerations for each phase of emergency management. So you're going to need to review the phases of emergency management in order to conduct that. So 3 per phase. And you need to have some rationale. Why are you considering this? Why is this an evidence-based consideration for that phase? I want you to create 2 communication messages for social media. 1 for the response phase and 1 during the recovery phase. What would you share via social media in each of these phases that would be appropriate? And then also talking about how you would address family members that were arriving in your department. So there's a variety of considerations, but it's kind of looking at all of the phases, what needs to happen during each phase based on this practice setting that you're in, and then how do you communicate with the public on these things that are happening. So make sure you'll use APA format for this assignment. You'll want to review, again, the assignment descriptions, the rubric is posted to Blackboard, and you'll have some other resources in order to follow through and complete this. Thank you for listening today.